guys, Stacia and I are here today to make a video for you on how to set up your TPN lines, prime them, and get everything hooked up. So we're going to start with talking about all the things that you need. So you need hand hygiene, clean gloves, a bouffant cap, a gown, cleansing wipes for the surface, a sterile towel, sterile gloves that fit you, a couple flushes, IV tubing that has a filter, regular IV tubing, a tri-set, and then an IV pole with 2 chambers, your TPN, which will be a yellow bag, and your lipids. You can do this in 2 places. You can do it at the patient's bedside or the bedroom. You have to be able to control who's coming and going and make sure appropriate PPE is on. So it's up to you which one you choose. For our unit, I think it's easier, especially as we get comfortable, to use the med room. You can use a Mayo stand, a bedside table, or a counter space in the bedroom that you can clear off and make sure it stays clean while you're doing this. So for the purpose of this, I'm going to be in the bedroom, and this is my counter space as we get started. So my door is closed, and I've asked everybody to not come in and out except the people that are in here that need to be in here with me as I do this. I'm going to do hand hygiene, put on clean gloves, and I'm going to clean my surface. So I'm going to clean my surface and keep it wet for 3 minutes. Scrubbing, scrubbing, scrubbing to make sure it stays clean and wet for 3 minutes. Fast forward 3 minutes, and I'm going to take these gloves off and start working towards applying my PPE while that dries. So I take these gloves off and I start applying my PPE. So I'm going to put my bouffant on. I already have my mask. I'm going to get my gown. And I'm going to make sure to use my ties. I'm going to do hand hygiene. Get on clean gloves. And I'm going to get my sterile towel. I'm going to open my sterile towel, place it down on my surface. The towel's inside of this blue packaging. And I'm going to lay my towel down. It's okay for it to be on the blue paper. It actually absorbs if anything goes through the towel, so you keep your space clean. The next thing I'm going to do is dump my supplies into my towel. The only supply that is sterilely packaged is your tri-set. I'm going to open it first and place it on one side of my towel. I'm then going to open the other supplies and place them on the other side of my towel. They are not sterilely packaged because they have purification. So I'm going to drop it onto this side. That's my regular IV tubing. This is my IV tubing with a filter. I flush. I have all supplies on my towel. So I'm going to take my clean gloves off, do hand hygiene, and put on my sterile gloves. we know as we do this that these items are not sterile, and this is not a completely sterile process. We just want to keep it as clean as possible, going from the cleanest to the dirtiest. So we know it's not perfectly sterile. We're just doing our best we can to make sure that it stays as clean as possible. So we're going to start with our tri-set. If you've never seen a tri-set, it has 3 extensions, a blood port, and then the part you connect. The yellow extension is typically used for your TPN. Your white extension is typically used for your lipids, and your green extension is for anything else that you need it to be. In this purpose, it's not going to have anything attached. We're just going to put a flush there. So we're going to attach all of our lines first. So we're going to start with our yellow, which is our lipids. The lipids is the one that has the filter. We're going to find the end that has the cap, pop it off, pull back the spinner, connect, push, and spin. That's your lipid line, or your TPN line, sorry. Now going to your lipid line, which is your white extension. This is your regular tubing. You're going to find your cap, pop it off, pull back your spinner, push in, twist. And then for this last one, because I'm not hooking anything here, I want to flush to make sure that their line doesn't have air. When you go in, if you need to use it for a medication or to hook another line up, you assume the person before you flushed it, so it's a really important step as you set up. So we're going to take our flush, connect, but we're not going to prime yet. We're going to have everything hooked up before we prime. At this point, I'm going to make sure that everything is clamped before I go to my fluids. Here's my filtered line, clamp, my lipid regular line, clamp, and we're ready to go over to our pump. So we have our pump. When we bring our lines to our pump, we want to make sure that we're not letting the lines hit the floor, the sink, the trash can, keep them as clean as possible. So the first thing we're going to do is our TPN line, the one with the filter in yellow. We're going to take off our cap, twist off the plastic piece, and we're going to spike all the way to the connection. We're going to do the same thing with our regular tubing, our white. Take off the cap, go to the blue port, all the way up to the connection. We now have everything hooked up, and we can start priming. So we're going to start with the TPN, which for this, the bag doesn't have TPN in it, but imagine it's yellow. We're going to squeeze a little into our chamber. We're going to unroll our clamp, and we're going to let it prime. Some tips and tricks, if you've never primed a filter, the back of the filter will fill first all the way to the top of this circle, and then it'll flip and fill up the front of all these little chambers before it comes out your line. I'm going to prime it to the end, turn off my roller, and clamp my yellow clamp. Same thing with my lipids. Squeeze into your chamber, undo your roller, and let it prime. We're going to let it prime through, stop our roller, clamp our white. Then we're going to come to our green, which is our flush that's already hooked up. And we're going to prime this short extension through so we know that it's been primed. And clamp that piece. Everything's primed, everything's hooked up. While I'm in the med room, I can get my green Kuros caps and cap all of my spots. I can take my flush off and put a cap there as well. And then I'm ready to go to my patient. When I go to my patient, When I get in the room, I'm going into their line, so I need to have my things on. I need to have a towel to lay underneath their arm or leg or whatever, the device, for the purpose of this, an arm. So I'm going to place my new towel, my patient, and have my line ready to hook up. I'm going to get my hub scrubs, have everything ready. I'm going to do hand hygiene, put on a new set of gloves. I'm going to hub scrub. Get my flush. Flush. Hub scrub. Connect to my patient.
Wait. Is that the call?
Excuse me. Back to my line. I can then place these guys in. TPN. Lipids. I'll unclamp, and then I'm ready to set up my pump. Set up my pump just like I would for any other bag. Scan my TPN, scan my lipids. It is a 2 independent check for TPN. So I'm going to scan it. I'm going to make sure all the 5 rights, but then I'm going to check the ingredients against what's in the MAR and make sure the ingredients are correct. Once I've checked that, I set my rate, and I set my rate, and then the second RN comes up and does the same. 5 rights, ingredients, check. Before I hit start and sign them off, I hit start and sign them off, and they're good to go. Important thing to remember with TPN, can run over 24 hours. Sometimes it doesn't, and it's cycled over, say, 10 hours. Whenever TPN is cycled, it'll run for the majority of the hours at one rate. The last hour will be cut in half so that the patient doesn't experience a quick dextrose drop. It'll be in your order, it'll be on your bag. So say this person's running for 10 hours at 22 mLs, they'll run for 9 hours at 22 mLs. For the last hour, I'll go in and stop it or cut it in half to 11. Let it run for that last hour at 11 before we disconnect. Again, it's important so that they don't get extreme dextrose drops after they've been running dextrose for a long amount of time. And that's your TPN.